Tennis elbow is a widely misunderstood diagnosis, and one of the reasons why is because the clinical tests used for it are very basic and generalized. Basically, they just tell you if you have tennis elbow or not, and in all reality, if the outside of your elbow is hurting, you know it's probably tennis elbow. So we like to use a more specific way of testing this. Now, you may have heard of the 3 common tests, right? So the first one is elbow bent, wrist extended. This is called the Cozen's test. There's also the Maudsley's or the finger extension test for the middle finger. This is where you just try to extend and lift your middle finger up and you resist that. And then there's also the Mills test, where you basically are doing this forearm extensor stretch with the elbow extended. And clinical testing says if any of those are positive or create your pain, then you know it's tennis elbow. It really doesn't tell us what's going on though, and it's not hard to figure out if you have tennis elbow. So instead, this is a series of tests to make this more specific. Figure out what particular structures in your forearm and other areas of the body might be causing you to have tennis elbow pain. Because the pain's not random. Before we can get this better, we got to isolate the specific structures or areas involved. Now, tennis elbow is highly impacted by body mechanics, right? That's a much more dynamic area of testing. That's something we don't cover in this video. If you feel that your pain might be correlated to body mechanic deficits, there's a link in the description to book a consultation call to discuss your case. That obviously is going to vary person to person. This video is just for isolating common structures involved with tennis elbow. So the first one is the most common, and that's why we have clinical tests. It's testing a muscle called extensor carpi radialis brevis, or ECRB. And so the tests in a clinic are for this muscle. So there's 2 tests. The muscle attaches to the base of your middle finger. So the resisted middle finger test, as well as the wrist extension elbow bent putting pressure. That's to test ECRB. That's the most common. That's why we have those clinical tests. But oftentimes that muscle could be involved, but it's just one of many things going on. So the next most common is the bigger brother of ECRB, called ECRL, or extensor carpi radialis longus. This attaches higher up on the arm. So it doesn't actually attach to the tennis elbow tendon, right? We have 4 muscles that do. This one does not, but it highly influences how pressure goes in that tendon. Since it's higher up, this is more impacted by elbow movements. So if you're noticing a high pain spike with extending your elbow, there's a good chance this muscle's involved. So we test this by doing the resisted wrist extension test with the elbow extended. That's going to hurt for a lot of people. And so we want to make this a little more sensitive by also pushing on the index finger where this muscle attaches. So out, and then we're pushing on that middle finger. If you notice that pain really spikes, you know there's a likely ECRL involvement. So next we'll go through the 3 other muscles that attach to the tendon. The next most common culprit is extensor digitorum. That's the muscle that extends your fingers. And so to test that, we want finger and wrist extension with the elbow bent, and we're just applying a pressure to the back side of the fingers, and you're resisting that pressure. If that spikes your pain, you know that you have an extensor digitorum involvement. The next muscle is ECU, or extensor carpi ulnaris. That helps to deviate the wrist to the pinky side as well as extend the wrist. And so for this one, we're going elbow bent. We're going to deviate to the pinky side, and then you're going to tilt it back just a little bit, up and over with this hand, and you're basically trying to pry it down into the thumb side. Give a good tug there. If that reproduces your pain, you know you have ECU involvement with your tennis elbow. Now the next muscle is so small and doesn't really impact the tension in the tendon. And so we don't test for this all that much unless I really feel like it could be involved. But it's extensor digiti minimi, or digiti minimi. That extends the little finger. So as you can imagine, not a lot of force generation there. But we would test this by elbow by the side, extend that pinky finger, and then push on the base of the pinky finger. Most people feel like it just feels weak, which is very normal. So we've got a lot of other muscles that can mimic tennis elbow. And the first and the most common is the supinator. Now the supinator is one of the 2 rotator cuff muscles of the elbow. So pronator is on the inside, supinator is on the outside, they not only do the rolling motion or rotation of your forearm, but they also stabilize. That's why we call them the rotator cuff of our elbow. And so if our elbow is lacking stability, sometimes that can be correlated to a supinator deficit. So we test this by interlacing our fingers to just isolate supinator and see if that's our problem. Then I'm going to try to roll palm up as hard as I can while my other hand braces the hand and doesn't allow it to move. So there's not actually movement going on in my hand, but you can see my forearm muscles are contracting, trying to roll palm out. Now, if this hurts, you know you have supinator involvement. There's a potential that it's not just supinator, but a lack of elbow stability, we extend the elbow and then we roll into supination. Do note that if you have pain just with extending the elbow before you supinate, that's not supinator. There could be a elbow stability issue, but that's likely ECRL or just sensitivity of a tendon. So make sure with this one, you don't notice the pain spike until you actually try to roll palm up. And then you know you have a supinator deficit as well as an elbow stability deficit. We want to do one more test at the forearm level before we go upstream. And that is to see if we might be getting compression of the radial nerve as it travels to the back of the arm and into the back of the hand. The way we test that is we want to tuck the thumb, fingers over the thumb, flex the wrist. From this position, we're going to roll the thumb under, so we basically are palm up here. Now we want to take our opposite hand and we're going to push and shrug the shoulder down, and then we're going to tilt our ear, opposite ear to the opposite shoulder, and you're going to bring this up. Now, you're always going to feel some degree of a stretch. We're not looking for a stretch. If you notice that that pain really spikes, burns, or jolts, or just feels really intense, you could be dealing with a radial nerve compression through the elbow. So now that we've gone through all the muscles at the elbow region that can contribute to tennis elbow pain, we want to look at a couple other areas that also can create pain here, but are coming from upstream. And the first is the way that the nerve travels out of the neck and out of the shoulder girdle. We can have compression there that can mimic tennis elbow. And so we test that by what's called a ruse test. So you're going 90 and 90, elbows at 90, shoulder at 90. And then you're almost kind of lightly rolling this backwards. So from a side view, I got a pure 90 degree. And then from this position, I'm opening and closing my hands. Fairly slow and controlled. Now you want to do this for 30 to 60 seconds. If you notice your tennis elbow pain increase, then you know that there could be a correlation of nerve compression that's causing a referral pain to the elbow, and that's something you would want to look into. Now, the other thing is we could have a compression of a nerve root at the neck level. And so the way that we can help to test this out is by what's called a Sperling's test. And so if my tennis elbow symptoms are on my right hand, I actually want to look to my left. And I'm going to look 45 degrees, and then I'm going to look straight up to the ceiling. And I'm just going to hold that position. Now you want to hold that for about 30 seconds, and if that position starts to create elbow pain, then you know you might be dealing with a nerve root compression. We can also repeat this test in all areas of neck position if you do feel like there's something going on, to further isolate where in the spine, in the cervical spine, you might be getting tennis elbow symptoms coming. So this is a series of tests, just of some of the more common presentations. Now, once again, if you want to go through the full evaluation of how the body mechanics influence this, there's a link for a consultation in the bio and as well as in the instructions below this video. Just note that oftentimes forearm muscles and pain in these areas we just discussed is just a symptom of something else going on. And so we really want to figure out what's going on in the whole system that's causing these forearm muscles to be overstressed and overworked.